Hey guys, welcome to another episode of Civilian Medical Podcast. This is episode 70. I think I'm going to name this one Is There a Medic on Board? Because we're going to talk about some cool flight stories and not like what Prep Medic does. Like Prep Medic has his flight stories, but basically he's an air taxi. So he's not really even a paramedic. He's just a glorified taxi in the air and makes a lot of money at it. So I decided to get somebody who's done some real emergency stuff in the air. So I've got my friend Bobby Wells, who's done a lot of flying in the last few years and has some pretty cool stories for us. So introduce yourself, Bobby.
Hey, good morning. I'm Bobby Wales, and I'm a paramedic. I'm based in Plano, Texas, but I used to work in South Carolina with Dietrich, so we go back a ways. I've been out here in Texas for 12 years now, and I think relevant to this conversation, in the last 12 years, I've flown about 1.6 million miles on commercial airlines all around the world. So I've had a few opportunities to stand up and help a patient on the airplane.
But you used to be a really good paramedic.
At one
At one time, you were a good paramedic. When's the last time you were actually a paramedic?
So obviously, I still have my National Registry card. So technically, I'm still a paramedic.
I have to talk trash a little bit.
I haven't worked on the ambulance since I left South Carolina.
Okay.
12
But
years.
you're having a fun time. You're doing good stuff.
Yeah, I'm keeping up. I'm still in the industry.
Yes. This episode is brought to you by Primary Arms. I appreciate them sponsoring the episode. Up until the end of the month, 31st, if you use coupon code FRN, you're going to get a free cleaning kit with every optic purchase. So, pretty cool deal. Go check them out, primaryarms.com. I appreciate them sponsoring this episode. So, like I said, this one is going to be, I've not flown nearly as much as you have. We're getting ready to fly in just a few weeks out west, but it never happens to me. Like, it never, like, I always, like, I do run up on calls a lot inside my county. I'm like, hey, there's a bad wreck, or hey, that's a cardiac arrest, and I'm just happen to be right around the corner. But it doesn't really happen in flight. So, you've started doing some TikTok videos, which I get sucked into TikTok every once in a while. Just scrolling through crap. But I've learned some stuff. I was like, holy crap. Like I learned there was some CPAP stuff and I was like, man, I'm actually learning stuff on TikTok. So pretty cool. But so you started doing some story time and I was like, hey, you should come on the podcast and let's have story time. So no real notes, just kind of going to flow through this and kind of see what happens.
Sounds good. Yeah, I was kind of surprised with the one video. I guess we'll talk about that story in a minute that really blew up. But I've only been on TikTok for a few months, but I do find that their algorithm is really good for pointing you toward content that you would really find interesting. So I found some really great medical discussions on their channels or accounts, whatever they're called. And it's really been interesting to hear some of the other content that's on there. But yes, people seem to be very interested in emergencies that happen on flights. So I'd be happy to talk about it and go through a little bit of the legal side of it. From what I found, I'm not a lawyer, but I can use Google with the best of them, and a little bit about what the FAA requires and how the airlines usually manage the situation.
And just an FYI, I screwed up. So when I hit record, we're actually live. So we're doing a live show right now. I didn't realize that. So we're doing it on the Civilian Medical YouTube channel. So I totally messed that up. We're just going to keep it going. So we do have a couple people watching. So FYI, we do have people watching. I was like, holy crap, why aren't people watching this? And it's because I screwed up. So we may get some random questions get popped in there.
All right, we can work with that. But now there's no edit button.
There is no edit button. So be very cautious. My HR department doesn't care. I am my own HR department, so you gotta be careful. Awesome. So start us with a story.
All right. So I think the one that has had the most splash and most people find interesting is a story I ran a call a few years ago on an airplane. I still call it running a call. Just old terminology, can't get rid of.
Yeah.
I've flown a lot to Europe and the Middle East, and whenever I do that, I always fly Dallas to London on American Airlines and then connect on British to wherever I'm going. And so in this particular flight, we were on our way to London, somewhere over the western part of the Atlantic, Newfoundland, Greenland area, no man's land. That's kind of the part of the flight where you have the longest distance to any airport. I had gotten upgraded to business class, so I was sitting there kind of enjoying myself with my feet up. And we hit a long patch of turbulence. So they kept coming over the PA and reminding everyone, stay seated, keep your seatbelt on. But then they came on and said, hey, we have a medical emergency. Are there any healthcare providers on board? If you are a healthcare provider, ring your call button. So usually they would say, get up and go to the back of the plane or the front of the plane. In this case, they said, ring your call button. So I pushed the button, waited, nothing happened. They came over again and said, we really need a healthcare provider. And so I was like, well, I can't ring my button more. So I got up and went to the galley, and there was a flight attendant in there. And I said, hey, I'm a paramedic. I'm happy to help. And she said, oh, thank you. She's like, we have a nurse back there taking care of him right now. Just go back to your seat. And we'll let you know if you're needed. And I said, okay, I'm available if you need me. Went back to my seat, buckled up like a good rule follower, and nothing happened. So 20 minutes later, she comes back by and pats me on the shoulder, and she says, hey, thank you so much for being willing to help. Unfortunately, he didn't make it. And I said, do you mean he died? And she said, yes. And I said, oh, that's really too bad, because, I don't know anything about that nurse. There are some fantastic nurses out there that could have handled the situation really well. The nurse, maybe she worked in a podiatry office or something like that and just had never done a resuscitation before. But either way, it doesn't matter what your credentials are. You don't want to run a resuscitation by yourself.
No, you're gonna, and she's probably CNA too, just to talk some trash about our nurse friends. Probably CNA.
It's possible.
But yeah, we just did an episode with Prep Medic our last episode, and we talked about CPR and about how it's not a difficult skill to do. Honestly and truly, it's not a difficult skill, but it's tiring. And man, about a minute and a half, 2 minutes in, I'm smoked. Doing good high quality chest compressions, I'm like, whew, all right, when are we gonna get to 200? I'm ready to swap. So let's swap out. So it's not a difficult skill, but at the same time, if you're doing CPR for more than a couple minutes, you're not doing good CPR. You need to swap out.
Yeah. I mean, you've taught CPR. So, people come into a CPR class and their questions are always, am I going to break ribs? What if I do it wrong? When they leave, their main takeaway is, oh man, that was a lot of work.
Mm-hmm.
So yeah, I can't imagine. I don't know how long they tried to resuscitate him. I never got any further details. I never went back to that part of the plane. The flight attendant suggested that they were going to keep the body in the seat, and for whatever reason, I don't know if they thought it was suspicious. They wanted to, maintain the scene where it was. I did have one flight attendant comment on my video on TikTok that is absolutely not the policy. They'll move them to the galley and cover them with a sheet or something like that. But
yeah, that was my question. What happens when someone dies on a flight? Do they just put them in the aisle and got to step over the patient, or do they move them to the luggage compartment? What happens to a dead body, or something like that on a flight?
So that's what I've been told, is they typically move them to the galley. But I was also told that they never ever announce over the PA what happened, because it's bad for business. But when we landed in London a couple hours later, they did come over the PA and said, hey, look, I know you're all excited to get off this plane, but we had a passenger die during transit, and we need you to all stay in your seat so the police can come on and do an investigation. So London police came on. It only took about 10 or 15 minutes, and they determined that the rest of us were not suspicious enough and let us go. But it was quite the interesting situation that happened.
So you may not know the answer to this, but if a crime does happen, we're kind of scrolling off a little bit, but if a crime does happen, international, you're flying over international, you're in a plane, a crime happens, this guy was stabbed or choked out or whatever, is that FBI, or is who land? Is it lands? Is it will be London police to handle the investigation? Who's in charge on an international flight?
I am not entirely sure on that. I would imagine, with the way that the U.S. tends to write laws, that they would say that until the plane lands, they're happy to have jurisdiction over that plane.
Yeah, I was just curious. Like I said, I figured it's kind of random, but I was curious.
I've not really looked up the legal side of crimes. I've looked up the legal side of what happens when you're helping with a medical emergency, because that's kind of important to me.
Right. And we'll talk about that in a few minutes.
But now I'm curious about what would happen if someone commits a crime on an intercontinental flight.
Yeah, what happens if you pull out your 1-inch blade, I think, which is legal to carry. You can't carry anything major, but you can carry a little something. You pull out your pen and you stab some guy in the throat, hits a carotid artery. Whose jurisdiction is that? So I don't know. That's curious. All right, yeah, I think that's an interesting one. Going back to it, is there anything you would have done different? Like, if you'd have known like the guy was that sick, push the issue a little bit more, going, hey, look, I am a paramedic. Like, what kind of like are you an ER nurse? Are you an ICU nurse?
Right.
Are you a GI doctor, like GI nurse? Like, what kind of nurse are you? And kind of push the issue a bit more. But anything you would have done different?
Not really. I had no indication from talking to the flight attendant that it was that critical. And, I had responded to maybe 6 or 8 or so prior to that had not been as critical. So I just kind of thought, well, if they need me, they'll come get me. But they didn't.
But they didn't. They didn't. They're like, hey, can you help move the body now? Like,
The part between sick and dead, that's what we're really good at as paramedics.
yeah.
So
They're probably like, hey, we didn't need your help before, but we do need his help now because he's like 300 pounds and he's a dead body. Can you help move him?
no, I'm too old for that. Sorry.
Yeah. I'm like, oh no, that's, you guys created a dead body. You can have it now.
You need to go back over the speaker and call for a firefighter.
Oh boy. This is it. We've talked trash about nurses. Now we talk trash about firefighters. We're going downhill quick. And we are made fun of Sam, prep medic, being a flight medic. So he said,
doctors, right?
Yeah, he said if I did not talk trash about him, he would be disappointed. So I've got free game to talk trash about him. Awesome. So what is another cool one you can think about?
I did have one flight. It was a interesting situation because we had 2 medical emergencies at the same time, but it was pretty obvious what they were. It was a flight in the Philippines from one city to another. We were flying from Manila to Davao, and we hit the worst turbulence I've ever felt in all of my years of flying. I mean, like, usually, your drink kind of shakes a little bit on your tray and you're like, oh, this turbulence is terrible. But this time, like, there was stuff. There weren't people flying up to the ceiling, but things were definitely moving around. If you had something on your tray, you had to grab onto it, and people were screaming. So, of course, not surprisingly, 5 minutes after that, they came over and said, we have a medical emergency on board. And it just so happened I was flying with another EMT and 3 doctors. We were leaving a medical conference and we were going to visit a hospital in the south of the Philippines. So we kind of all were like, oh, well, I'll let the local doctors handle it as opposed to this medic from the US. And but then they came back on and said, hey, we've got another one. If there's more people that would volunteer, that'd be fine. And it was both 2 people that had anxiety related to the turbulence. One was complaining of chest pain and one was complaining of respiratory distress. And that's when we learned that whatever the Filipino equivalent of the FAA is not as strict on making sure that they check off their medical equipment, because they had oxygen tanks on board, but they were empty.
Oh.
So we put oxygen masks on people and then went to turn on the tank and there was nothing there. So I was talking to this nice little lady who was probably 70 years old and complaining of shortness of breath, and she was very, very anxious. So I just sat with her and talked to her for the rest of the flight. It was a very short flight, and that seemed to resolve the situation.
Is there like a standardization of first aid kits and supplies on flights, or is it basically what the company wants to put on there?
In the US, the FAA does have regulations around that. And the FAA's regulations are effective for any airline that comes into US airspace. So if you're taking off or landing from the US, you have to follow these regulations, regardless of where your company is based. If you are a company that is not flying into the US, or you'd never fly into the US, you don't have to meet those requirements. Whatever the other countries are that you fly to, you have to know what those requirements are.
Yeah.
So the FAA does have a standard minimum kit and preparation that they require, but airlines are allowed to have more on there than the FAA requires, but not less.
I don't see they're going to have more. Like, I doubt it. Like,
they're generally not going to have more.
They might have like a few more Band-Aids than they're supposed to have, but that's about it. Like,
we go above and beyond. We have 6 Band-Aids.
Yes, exactly. Like, I don't see them carrying stuff like that. I assume an AED is part of that.
An AED is part of that. They have to have an AED. They have to check the battery. I don't know how often they have to do their check, but they do have to do periodic checks. And it is required equipment. So the entire medical kit the oxygen tank, and the AED are required equipment, which means the airplane cannot take off without it.
Interesting.
So on a more recent incident that I dealt with just like 2 months ago, we used the bag while we were still on the ground. There was a medical emergency on the flight. We used the bag, and then we had to wait 30 minutes or so until they could get another bag from their supply and bring it in, put it on the airplane, and do the appropriate paperwork for switching out bags.
That's interesting.
Yes. So in addition to, a couple Band-Aids, you have to have a blood pressure cuff, stethoscope, some OPAs, oropharyngeal airways, a CPR mask, like a pocket mask. They can also have a BVM. Usually, or they have to have a BVM as well. Sorry. You have to be able to start an IV, tourniquets, scissors, and then they have a number of different medications and syringes to pull them up and administer them. So you'd have antihistamines like Benadryl, atropine, aspirin. You have to have an albuterol inhaler, epinephrine, D50, lidocaine, nitroglycerin. So if you're dealing with diabetic emergency, cardiac arrest, shortness of breath, anaphylaxis, and you can pretty much handle any of those with the kit that's on there.
So I assume they are banking on there to be a doctor on scene.
So they do. The FAA requires that they only allow the bag to be used by healthcare specialists who are qualified to do that, and they leave it really up to the airlines to determine that.
Yeah, because I don't see when you said IV supplies, I was like, man, are they like I could see them having the flight attendants be CPR certified. I could see that being a requirement. That would be helpful. If they're not, they should be CPR qualified. And then when you said IV supplies, I was like, are they training the flight attendants to start IVs? That would be crazy. But I guess they're just banking on nurses, paramedics, and physicians being there to use those supplies. Hey, great, I need this, I need that. So,
well, most of the airlines in the U.S. provide training for their flight attendants as part of their initial training. They do a lot of training on evacuating the airplane and dealing with other emergencies and dealing with, passengers who are angry or disturbing the peace. But they also train them on medical emergencies. And one of the things they do is they do teach them CPR, basic first aid, and then they do a little bit more to kind of show them, they don't want flight attendants starting IVs, but they want them to be able to assist. So they will have to know you have to hang the bag somewhere. So either have someone to hold it or have a place that you can hang it or something like that, so that you can assist in an emergency. If it's one lone nurse in the back of the airplane working with a flight attendant on a resuscitation patient, there should be somebody there that knows how to help a little bit.
That's pretty cool. I didn't know that. I wasn't sure what kind of training they had. I knew about the evacuation, but I wasn't sure what kind of medical training they actually had. That's pretty cool.
The specifics do vary a little bit from one airline to the other. And of course, once you get outside the US, there's a million different variations on what they get. But for sure, there is some training on most of the major airlines.
That's pretty cool. I'm trying to think. Yeah, that's some cool. I've never had anything like that happen to me. I've only flown less than 10 times. Not super, but it is interesting that, that they do have a good bit of supplies on the plane. Because when I fly, I usually do take a trauma kit with me.
Mm-hmm.
I will fly with a tourniquet, pressure bandage, combat gauze, chest seal, stuff like that. Because typically when I've flown, I'm going to do some work. So it's usually we're going to shoot wherever we're going to. So I at least want my trauma kit there to make sure we're there.
Right.
And I haven't had any problems flying with a trauma kit. I know some people have gotten the trauma shear, stuff like that. Will get gigs just because they're longer than what they allow to. But typically flying with medical supplies isn't a huge deal. It's been years ago. We were flying out of Dallas, and Candace was still breastfeeding at the time, and we had to pump the breast pump, and we're flying in, and man, the guy must have thought it was a bomb or something, because when we went through X-ray, I guess he saw all the tubes and the gears and everything else, containers, and so I thought we were gonna get in big trouble, and Candace is gonna lose it because she's hormonal from the baby and everything else, and I was like, oh my gosh, this is it, we're gonna be in big trouble. And so finally some other guy that came over and was like, hey, that's a breast pump, she's fine, it's not a bomb. So we got to fly out of Dallas, but that's really the only thing we've had flying out of Dallas, we always have issues. I don't know why, but like we had that, and then typically we do fly with firearms, which is a pain in the butt. If you've never done that before, that's fun. And I flew out of Greenville just fine, no problem. I'd read the rules and it was good. And then when I flew out of Dallas, my ammo was still in my magazines in
Oh,
a
yeah.
locked case, and they freaked out. They're like, "You can't do that. It has to be in a box." And I'm like, "Well, I don't have the original box." And they're like, "Oh, well, you got to empty your magazines right here." And I was like, "Are you serious?" Yeah. So I opened up my box, and there's my Glock 19 with 2 magazines loaded to the gills, and I unloaded it. And like I told the guy, I was like, "Look, this isn't your fault. I completely understand. These are somebody else's rules." I said, "But understand that I'm a shooter. Like I shoot a lot, and you have 2 full magazines here. I could load them and do some bad things before anybody ever reacts." He was like, "I know it's a stupid rule." I was like, "Okay, as long as we're good, that you know it's a stupid rule, I know it's a stupid rule." Like the guns are locked up. No one's gonna mess with them. I got the key. They're locked up. Now you want me to open up on a counter with 500 people, and I got 2 full magazines, and your security guy is not gonna touch me for a while. And whatever. But yeah, no, I've never had anything. I just had flying out of Dallas is a pain in the rear. I hate Dallas.
I think it's a great airport. One quick thing on the who was allowed to use the equipment on the plane, to go back to that. Airlines can have different rules. And I know that with American Airlines, I have been told more recently that their policy is that only a doctor can open the bag, or a PA or nurse practitioner, somebody who has the ability to prescribe medications, because they want to have that level of coverage for liability to let them open the bag. However, if there is not one available, the captain can authorize another healthcare provider, like a paramedic, to open the bag.
Nice. I was like, I would flip out if I had like an anaphylaxis patient, and like I know there's Epi and Benadryl in that bag, and I'm like, "Look, doc, I like flight attendant, I know the dose to that. Like I can draw it up. I can give. Like you gotta trust me. Here's my YouTube channel."
Right.
But I was like, "Look it up on YouTube. I'm good on the
You know what
video
I'm talking
stuff."
about?
Yeah,
Yeah.
not really, but I got a good editor. Um, but yeah, like that would be frustrating. But at least they could make a exception if they had to. Like I at least know what I'm doing a little bit here, so
Right.
that's interesting.
Yeah. So recently, the one I had most recently, I was on a flight in Charlotte. We were still on the ground. I had also gotten upgraded on this one. I'm starting to see a pattern here.
Yeah, I'm gonna say
Sitting in the front row of the airplane, and right before they were going to close the door, everyone's on. We're ready to go. A very anxious flight attendant came over the PA and said, "If there's a healthcare provider on board, please come to the back of the plane now." So I was like, "Oh, well, that sounds." You always get a little bit of a gauge by the tone of their voice. I was like, "Oh, well." I peeked back because I could look all the way down the aisle, and no one was getting up. So I thought, "Oh crap, I guess I have to do it." So I got up, went almost all the way to the back, and there was a teenager there, and she was breathing really fast, had her eyes closed, drooling, and the flight attendant said she's having an allergic reaction. And so I started talking to her, started immediately getting a sense that maybe I wasn't dealing with an allergic reaction. They brought the bag over, but the flight attendant who brought the bag over wouldn't let me open it, because he asked, he's like, "Are you a doctor?" And I said, "No, I'm a paramedic." He's like, "Well, you can't open this bag." And I said, "Well, there's a stethoscope in there that I'd really like to use." And he said, "I can't let you open this bag. You have to be a doctor or a nurse practitioner or a PA." So I'm like, "All right, fine, whatever." So I was assessing the patient. Her pulse was still kind of normal. It was like 88. And I noticed that even though she was breathing really fast, she seemed to be moving good air. And she was making some noises in her throat every time she breathed in, but it didn't really sound like stridor to me. So I was not too terribly worried about it. She was answering my questions. Even though she had her eyes closed, she would answer my questions. She had no background. She had no history of allergic reactions. So I said, "Well, what makes you think you're having an allergic reaction?" She said, "Well, when I got on the plane, I smelled something weird, and then I started getting this scratching sensation in my throat." And had her open her mouth, didn't see any swelling. There's no hives, nothing. Start to feel like this is probably anxiety. But I really would like to listen to her lung sounds, and that would be great. So while I'm talking to her, I hear, we're still on the ground, of course, we're waiting for the medics to come. So I knew it shouldn't take too long for them to come through the airport. But I hear behind me, I hear a guy say, "Oh, I'm a doctor. Can I help?" And
You should open it back.
he said, I'm a healthcare provider. Can I help? And the flight attendant said, what kind of healthcare provider are you? And he said, I'm a surgeon. The flight attendant said, oh, I was hoping for a doctor. And I was like, no, he's a doctor. He's a doctor. He can open the bag. He's enough of a doctor.
Enough of a doctor. He graduated. He's good.
Yeah, he's an MD. He's good. Open the bag. Give me the stethoscope. So they opened the bag and gave me the stethoscope. And I said, what kind of doctor are you? He said, oh, I'm a neurosurgeon. I was like, all right, hang out. I'll let you know if I need you.
Yeah, if we're having a stroke here, we'll let you know.
Listen to lung sounds. They were clear. O2 sat was great. Like, all right, this girl is definitely not having an allergic reaction. Meanwhile, word is spread throughout the airplane that there's an allergic reaction going on, and people start materializing with EpiPens. So someone taps me on the shoulder and hands me this EpiPen, which I'm not going to use now. And I set it on the seat next to me, and I just said thank you. And then I get another tap on my shoulder, and it's somebody that has an EpiPen with Benadryl tablets taped to it. And they hand it to me. I'm like, oh, thanks. Set it down on the seat, go back to what I'm doing, trying to check a blood pressure. Checking the blood pressure, and all of a sudden I see, so she's over in the window seat, and I'm kind of in the middle facing her. All of a sudden I see this hand reach across in front of me with an EpiPen opened with the cap off, trying to go toward her leg. And I literally like grabbed the guy's arm, and it was not the doctor. It was just some random person that came up with an EpiPen and decided, oh, I know what to do. I'm going to give this to her, which I appreciate their enthusiasm, but it certainly was not the right thing for this patient.
Oh my gosh. Like, stop.
So then set that down on the seat next to me, finished taking care of her. And a few minutes later, the medics showed up, and they took her off the plane, assessed her on the right outside of the plane in the tunnel. They talked to her, but they quickly determined it was also an anxiety attack and immediately told the flight attendants, well, she's good. She's calmed down now. And, so she can get back on the plane and go. But the flight attendant was not sure. So he went he went and asked me, he said, what do you think? And I said, I don't want to be the one that makes that decision. And we'll talk about who should make that decision in a minute. I said, so what I said, they have a lot more equipment and ability to assess her than I do. So I would defer to their decision. He didn't like my answer. So he went to the neurosurgeon, who was sitting a couple rows back on the other side of the plane. And the neurosurgeon said, well, it probably is an anxiety attack, but if there's even a 1% chance that it's an allergic reaction, she shouldn't get on the flight. So the flight attendant goes all the way back up to the front and says, the doctor said she can't get on the flight. And the medic came on the plane in the middle of the aisle and starts engaging with this neurosurgeon. And he was trying to be nice and just saying, well, that's just, that's my opinion. I don't think it's a good idea if it is an allergic reaction for her to get up in the air and then us to have another problem. And the medic's like, it's not an allergic reaction. And so they're having this discussion about the patient in the middle of the aisle, like not close to each other, just everyone can hear it. And by now we've been delayed 30 minutes, 40 minutes. So another passenger starts piping off about, well, let's just make a decision and get going. And the medic turns around and starts screaming at this lady, like, I'm sorry that this emergency has inconvenienced you a little bit. Well, it was crazy.
Dang.
So eventually they did the right thing, which was the medics who assessed the patient called American Airlines Medical Control. And basically they said, it's okay for her to fly, but just for operational reasons, let's put her on the next flight, which by now the next flight was going to leave like 15 minutes after us. So they ended up getting to Dallas maybe 15 or 20 minutes after we did.
Nice.
But we had to wait for the new bag to come and all of that stuff. So we were quite late getting into Dallas, but that's the way life goes.
Dang.
So the moral of that story is any decisions that need to be made should not be made by the healthcare provider on board about whether to land the plane, whether to, in this case, not allow a person on the plane to fly. The airline has medical control. They have doctors on call that the pilot can call through their radio and speak with. And so I have done that before where they have had me talk to the captain who has relayed information to the doctor and back and forth. And that doctor makes the decision because they have to weigh where you are, what is the the capabilities of the hospitals near you, and whether you should land, whether you should take off, all of those things. And then they assume all of that liability. So you definitely want to defer any of those major decisions to the medical control doctor.
That is great information. I had no idea about that. So that is
really,
cool that you
really
can,
big deal.
because I mean, there's definitely times like they're making a decision like, do we need to divert to land somewhere at a closer airfield, or do we keep going on our trip? Like that's a decision I don't want to be responsible for, because you're gonna have a lot of passengers angry with you, going, "Hey, I just thought to divert because this lady might be having a baby or whatever."
Right.
And so that's a great call that we don't have to make that decision. That we can say, "Hey, the medical control is the one that said we need to land at the closest airfield," and go that way.
There's also some safety issues to consider with it as well, because when they plan out a flight, they plan to have the amount of fuel that they need for that flight plus a certain amount extra, so that when they are landing, well, first, the airline doesn't want to fly more fuel than they need because it's heavy, and then they burn more fuel than they need and they spend more money. So, but also because you don't want to land with an airplane full of fuel. One, it's obviously much more of a hazard if anything goes wrong, but also because it's harder to land. The plane just doesn't have the same aerodynamics when it's full as when it's empty. So you have an extra landing, an extra takeoff, and you're doing it with extra fuel on the plane if you have to divert somewhere. So there's extra risk involved in that. And that's another thing that's really good, to let the airline take that risk on for that decision. So I've had that happen one time, where same flight, Dallas to London, and we were much earlier in the flight. I think we were over Michigan somewhere, and they came on and asked for a healthcare provider. I went to the back. There was another person there. She was a resident. I forget what her residency was in, but it was not emergency medicine. She was very happy to see me and happy to let me take over. And it was a young woman. She was from the UK, and she had gotten malaria doing a journalism assignment in Africa at some point before, and it had caused some ongoing issues with her kidneys. And I didn't know if that was quite related to this or not, but it ended up she had a GI bleed. So she was vomiting blood, and she was passing blood through in her stools. It had started the day before, but she was under the impression that if she went to a hospital in the US and sought emergency care, that she would get a bill for hundreds of thousands of dollars, and she would not be allowed to leave the US until she paid off that debt, which is not the case. So she decided, well, I'm going to get on this plane and I'm going to fly 10 and a half hours to London, and then I'm going to call an ambulance and go to the hospital. But she got up early in the flight, went to use the bathroom, almost didn't make it back to her seat. And so we were called back, assessed her, very little hypotensive, very dizzy, faint, finally started like telling me the story. And she really, really was begging us, just get me back to England and I'll go to the doctor. And it's like, I don't think that's a good idea. So I talked to the flight attendant. They relayed everything to the captain, and the airline medical control made the decision to land. So we diverted and went back to Chicago and landed. Chicago Fire came on and got her, and then that was the last I ever heard of it. We went on our merry way after they did all of the necessary takeoff checks.
How long would the rest of the flight have been to London?
Well, it was about 2.5 hours to Michigan, so we probably would have had a good 6 or 7 hours. But the problem isn't as much the time as the fact that once you kind of go over Montreal or northern Maine, from there until you hit Ireland, you're really limited in the terms of what hospitals you can go to. There's airports where you can land. They have to have airports within a certain distance so that if an airplane goes down to one engine, they can land. So there's an airport in southern Greenland whose sole existence is for large airliners to be able to land somewhere if their engine goes out. And then, of course, you've got Reykjavik in Iceland. But they're not going to necessarily have Reykjavik will have some good healthcare, but like southern Greenland, you're probably not going to be seeing a tertiary care hospital there that can do emergency surgery. So you really don't want to get out over the ocean and have a medical emergency happen or have something get worse. So I would definitely say if you have a medical emergency, you want to deal with it before you get out over an ocean. And if you're going the other way from the US to Asia, you're going to go up over Alaska, kind of over the North Pole, and then come back down the other side. And that's also not where you want to be when you're having somebody with a critical medical condition.
Yeah. So John Holiday wants to know if I've fired Prep Medic already. Yeah, we talked about that at the beginning of the episode. I didn't realize we were doing a live show, by the way. So, no, Sam is just super busy, and I'd already scheduled Bobby to come on. So, we have been talking trash about Sam, Prep Medic. So, but no, he's not fired. He's on vacation, flying around somewhere, saving the day out in Colorado somewhere. So,
You upgraded to someone with better hair.
So, like, do you wear like the college you graduated from? Like, do you wear like that T-shirt or that sweater or something like that on the flight so they think you're really smart, or like how do you do that?
Not usually. No.
Not usually.
I'm usually a jeans and a T-shirt on the airplane with a hoodie in the backpack, so that if it gets cold, I can put that on.
So you blend in, because that's what I was curious about. Because I wasn't going to name the college. I don't know if the college would even like definitely would not appreciate the background. But Bobby is way smarter than me. He's graduated from some pretty cool schools. Yeah, so that's what I was kind of thinking about. You know, if a GI bleed, it's not going to fix itself either. Like, it's just going to continue to get worse. And so, if you've never smelt a GI bleed, they definitely have a very distinct smell. Like when you come into a house, someone complains of a GI bleed, you're going to smell. Like, you're like, if you smell one, you know what it smells like as soon as you hit the door. So when you were telling that story, I was thinking about like in the flight, if she's going to keep going to the bathroom, she's going to keep having bowel movements. It is a horrendous smell, and you can't hide it. So I feel bad for the people who are in the back of the plane, not upgraded like you are, on the very back, cheap seats. They're going to smell this GI bleed for the rest of the flight.
Yes, absolutely. But, you know, I think that for me, the biggest concern was just not getting where we couldn't provide any care for her and be far from a hospital. So unfortunately for her, she didn't get to go home that day.
Definitely. And like you said, at least understanding that if you're a foreigner here in the U.S., you need to go to the hospital. Like, go to the hospital. They'll figure out the financial end of it later, but they're not going to hold you. They're not going to trap you here.
Right.
The other thing financially I figured out recently is I had a meeting with our local helicopter service, and I had always been told that helicopter flight services are super expensive. You know, you fly someone out, they're going to get a $10,000 bill, and it's always kind of in the back of your mind when you make a flight call. You're like, hey, we're going to call for a helicopter to get you there a little bit faster, do some more things. And like, it's in the back of my mind to get stuck. Like, man, I hate to stick this guy with a $10,000 bill, plus the ambulance bill, plus the hospital bill, stuff like that. Well, our local flight service, we're talking to them, and they are in network with insurance companies. Mm-hmm. So, like, we flew a kid out the other day, allergic reaction. We were 2.5 hours from the hospital. We're up in the mountains on UTV. Like, we were probably an hour from the ambulance, and then, you know, another hour and a half where we're at to the large hospital. And so we flew him out. We flew him out from the trail side. And talking to him, I was like, man, I hate to make that call. This kid's super sick. He wasn't, you know, critical, but he is sick. And the 2.5 hours to get to a hospital is not going to be a fun ride. And they're like, man, that kid's going to get a $300 bill. I was like, what? I was like, yeah, if he has insurance, it's $300. I was like, well, that's very nice. And they're like, if he doesn't have insurance, he can pay us $1 a month, and we're good with it. I was like, well, that's nice. I mean, he's gonna have $1 a month for the rest of his life, but at least that, like, I'll just give you $1. This is the time I flew on a helicopter. Here's $1. So that's interesting. So, but it is kind of, yeah, that's interesting that she didn't want to be seen like that. That's not comfortable.
Yeah. So real quick on the flight charges and the in-network, one of the things that's changed in the last 5 or so years in EMS is that private equity firms have been starting to get really interested in putting together different combinations of healthcare services into one company and finding ways to make more money for them. So there's probably one of the largest private equity firms in the world is called KKR, and they bought AMR, the EMS system, and Rural Metro and MedTrans and a few other flight services. And they also bought Envision Healthcare, which is one of the largest physician groups in the country with, I think, 20,000 physicians. So these are all now part of the same company. So for them, it's not just about, hey, do we make money on this flight, but also, does it go to a hospital where our doctors are working, or a hospital that we own, or something like that? But also, years ago, if one flight service was trying to negotiate to be in network with an insurance company, that was one flight service and they had no negotiating power. But now you have a company that has tens of thousands of ambulances around the country, dozens or hundreds of helicopters, and tens of thousands of physicians that they work with. They have a lot of negotiating power. So they're able to get a lot more of these things in network than what used to be. So regardless of how you feel about how the healthcare system deals with a lot of these expenses for people, it has definitely worked out to the benefit of those who are insured to be able to get cheaper flights and things like that.
Yeah, that's pretty cool. That's interesting.
So back on the medical emergencies on airplanes, the one thing I would say, I know you have a lot of people that listen that are civilians, obviously, and trained in first aid. So I would emphasize, as always, don't go above and beyond any training that you have. You shouldn't be doing a surgical crike on a patient if you're only trained in first aid, or if your only exposure to it is watching some of Skinny Medic's videos. I mean, definitely watch the videos, learn the stuff, but don't go outside of your scope of practice.
So does the Good Samaritan law, I guess, would still cover?
So there's not only is there a Good Samaritan law for most states in the U.S., not all, but most states in the U.S. have Good Samaritan laws. There is also a federal law that protects people on airplanes responding to medical emergencies specifically. So it's its own law. Anytime you're in the U.S. or in a flight that originates or lands in the U.S., that legislation that was passed in the late 90s covers you. Again, as long as you're within scope of practice, not doing anything crazy. I'm not putting in any chest tubes or anything like that.
That would be awesome. So my question is, so what if I'm on a flight, something bad happens, say we'll take allergic reaction, that's the easy one. I've given Epi, Benadryl, got blood pressure, got vital signs, got a sample history, everything's good to go. Typically, what should I expect when we land and EMS wants to come on board? Like, how is that transition going to happen, and what should I expect there?
My experience is only twice have I handed off to people on the ground. So one was the Chicago one where we diverted, and one was the Charlotte one where we didn't even take off and we had this emergency. Both times, the medics did not want to talk to anybody who had been dealing with the patient. Actually, it was really kind of bad experience with both of them. They were both super rude. The one more recently in Charlotte, the medic came on the flight, walked back, got about 5 rows from where the patient was, and just pointed at her and said, "You get off the plane." Like that was her introduction to the patient.
Dang.
And when I went over and tried to talk to her, she just kind of said, "Okay, thanks," and then walked away. So I anticipate that medics who work, I'm trying to put myself in their shoes, medics who work at airports get this very broad range of providers who are helping patients on airplanes and do not always turn out to be really good in an emergency setting. And so they tend to just want to focus on getting the person off the plane so that the airline operations can continue and doing their own assessment. So I would have to say my handoffs have not been great, but there is EMS at every airport in the U.S. who's responding.
What about like internationally? Like, is it going to be typically, I guess it will obviously depend on what country you're in, but is it more like you're going to see, I'm trying to think how I want to word that. Like, be careful. Like, is it ambulance drivers coming on, or is it physicians, or is it paramedics, EMTs? Like most international flights, like who's going to be coming on board?
It all depends where you are. Most of mine have ended up in the UK. The flights that I take internationally where I've had medical emergencies, I guess I did hand off to one time to the medics in London. I don't remember a whole lot about that patient, but I do remember it was as we were landing, someone just needed some assistance. And but in the UK, they have paramedics. Occasionally, they'll also have physicians in the field. Other places, in Italy, most ambulances run with someone who's basically first aid trained, and then the other person may be another first aid person, or they may be a nurse who's got some extra training for pre-hospital setting. There's not really any medics there. Germany has paramedics. Sometimes they also run doctors in the field. It's all over the place where what that level of training is going to be. And then, of course, if you get away from major cities like London, Paris, Tokyo, and you get to some more random small town airport somewhere, you may not have anybody at the airport. So it's all over the place. You don't really know what you're going to get unless you're going into a major metropolitan area.
Awesome.
And then the one other thing I would say is that sometimes the airline will ask you for your credentials. So I always keep the National Registry app on my phone, because even offline on the airplane, I can pull up my paramedic card. And then I do have a Texas license as well, so I can also pull that up in my email. I keep it in my email. And then sometimes they'll send you a thank you. I've received miles from airlines before for responding. Sometimes it's 5,000, sometimes it's 25,000. Sometimes they want to give you a bottle of wine. The flight attendants want to give you a bottle of wine as you're leaving, but
sweet.
You have to keep in mind that if you're connecting on another flight, that it's not going to do you any good. So
just chug that thing.
So, and there's nothing else that they can give you that you'd want. Like, oh, you want some snacks from the plane? Well, no, not really.
No, yeah, some chips and a Coke would be perfect.
Yeah.
Awesome.
So, don't expect anything, but every once in a while they come through and you'll see something pop up in your account in a few weeks.
That's interesting.
Yeah.
Awesome. Well, thank you for coming on. Thank you for taking your morning off and come on the live show. I didn't realize it was going to be a live show, but I think it worked.
Charge you double the next time you do a live show.
Yeah, I'm like, people are going to be so mad that I didn't announce this, because the last one we did with prep, like we announced, hey, like weeks out, hey, we're going to do 8 o'clock. And this was completely my fault. Didn't realize this was going to be a live show. So if they want to watch your TikTok and they have a TikTok, what do you want to give out your TikTok?
Sure.
Where does them find you?
It's the same as my Instagram, which is rstantontx.
Okay. Do you post
I'm
on
not
Instagram?
super active, but every once in a while I go in there and post something.
Awesome. Cool. I appreciate you guys for listening and watching. This will go on all the podcast apps in a couple of weeks. We just posted one, so we'll wait a couple weeks and put this on all the shows. So still get your gear, your medical supplies at medicalgearoutfitters.com. We're working through some logistical stuff as usual. Just everything is on back order from the major distributors. We're talking 10, 14 weeks. So we're trying to stay ahead and trying to predict what we're going to need in the next 14 weeks, which from a business standpoint is complicated. And I'm trying to figure that out and learn. This is a whole new ball game. So I appreciate the patience over there. medicalgearoutfitters.com. You can use coupon code Civilian Medical to save 10%. Awesome. Well, you guys have a good week. Thank you, Bobby.
Thank you.